Dr. Becky Cooper.
Thank you, Madam Deputy Speaker. And I'd like to echo the comments that say thank you to everybody who has made contributions in this debate. It has been so heartening as a new member to hear so much agreement across the House and to hear so many people put their evidence and their enthusiasm and their opinions into really backing us finding a solution for this epidemic. I'd like to thank my honourable friend, the member for Stroud, for bringing this debate forward. Unlike my honourable friend who has a medical degree and has become a GP, I took my medical degree and went into public health. So I'm a public health consultant, and that's why I'm here. And as I say, it is so fantastic to hear everybody in this House, Madam Deputy Speaker, talk in such resounding, positive public health terms. It is past time for us to address this issue. There have been many great points made, and I don't intend to repeat them. There are a couple of things that I would just like to stress. The first one is an interesting one about the term obesity. It does carry with it a certain load and a certain stigma, and as a female in particular, I very much appreciate that. And I think I just want to put on record, Madam Deputy Speaker, that this is not about fat shaming. This is not about how people look or how society tells us that we should look. This is about our health. This is about being well and feeling well and being able to live well and to thrive. I also just want to put on record something about body mass index. This is a slightly controversial subject in my area at the moment. It is a useful tool, as people have said, but as my honourable friend has mentioned, there are different levels of BMI for different ethnicities, and also it can be a limited metric. I am sure the House might be aware of the case where a female Olympic bodybuilder was classed as obese. So we just need to be careful about BMI, and again, what we are saying to people, children, adults, when we see their BMI, it is taking health in the round. It is looking at what we eat, not what we look like. There is no debate about the evidence of obesity's cost to our population health and to our health system. We have heard these figures from multiple members across the House. 6.5 billion annually to the National Health Service. That is no small figure. From diabetes to heart attacks, liver disease to cancer, and we have heard that is the second most preventable cause after tobacco for cancer. We are literally eating ourselves into our sickbeds. I have spoken before in this place, Madam Deputy Speaker, and I will continue to do so, about creating conditions for people to thrive and to make healthy choices. Today, as so many of the honourable members here have highlighted, we live in an obesogenic environment. That's an environment that promotes unhealthy eating and does not make it easy to undertake regular exercise. Now, a less familiar term than the term obesogenic is the opposite of that. And perhaps Hansard has never heard this, Madam Deputy Speaker, but it is a leptogenic environment. And that's one that promotes healthy food choices and encourages physical activity. And I would also say the comments that were made about housing and the comments that were made about fair pay for good work, that's a leptogenic environment. We might perhaps reflect, Madam Deputy Speaker, about our own environment, whether it's an obesogenic environment or whether it's a leptogenic environment. I wonder how many of us, Madam Deputy Speaker, have managed to have dinner yet this evening and how we're feeling. Something to reflect on for the Modernisation Committee. To get to the state of a leptogenic environment, we need to be looking at measures that create a functioning food system, and we have heard this already. We need to work with our farmers and food producers to produce a skilled food sector and a vibrant food economy. For our food system to allow us all to enjoy healthy food, and again we've heard this before, we need to ensure that it is accessible, affordable and attractive. We are visual creatures. What we see really influences us and our choices. And boy, do the food organisations and the food companies know that. So in terms of accessibility, how easy is it to buy nutritious food? We've heard from members across the House talking about their constituencies, their residents, about food deserts, about how for some people going to a shop The choice is not an array of vegetables. The choice is not an array of fruits or decent carbohydrates or decent proteins. The choice is processed, often cheap, quite filling, nutritionally poor food. That's not accessible. In terms of affordability, we've heard several times from different members that healthy food, this is worth repeating, on average is over twice as expensive per calorie as less healthy options. Madam Deputy Speaker, for people feeding their children across the country this week on a budget, Madam Deputy Speaker, if they are faced with two different options, and one is cheaper and will fill their children's stomachs, the odds are they are likely to take that option. And there is no judgment in that at all. It is on us to make it much more accessible and affordable for people. And thirdly, how attractive is healthy food? Marketing and branding of ultra-processed food. We've heard about ultra-processed food this evening. High-fat, high-sugar, high-salt food. It is fantastic that our Labour government, that our Minister, Public Health Minister here, has taken the step to ban junk food advertisements before the watershed. That is a great step forward. But we do need to be mindful of how much investment the major brands of high-fat, high-sugar and salt foods put into advertising. In digital advertising alone, that figure was £87.5 million. Madam Deputy Speaker, we do not put money into things if we are food aid organisations that do not make profit for us. Profit essentially remains the bottom line for these companies, not our waistlines. So these are systemic issues, but we do not need to reinvent the wheel. We need to implement the wide-ranging recommendations in the National Food Strategy that I have to say were an opportunity missed by the last government. As we move forward in this government, let us look at the recommendations in that National Food Strategy, many of which have been mentioned in the House this evening. They include introducing a sugar and salt reformulation tax and expanding the Healthy Start scheme. So in conclusion, Madam Deputy Speaker, we need to ensure that we in this place are legislating to make good nutrition an easy choice for all, that we are creating a healthy, leptogenic, for the second time, environment. In this way, we will ensure that we are enabling healthy choices for all our residents and reducing obesity to a slim historical footnote as we move forward into a healthier future for everyone.